Dear esteemed veterinarians, a very warm welcome to today's session on how thoracic radiography can help to differentiate between heart disease and heart failure. Powered by Pimotone tablets, that is Pimobendan tablets 2.5 mg, 5 mg, and 10 mg tablets, and Pimotone Plus, that is Pimobendan 2.5, 5 mg, and 10 mg tablets with benazapil. We are honored to have with us our distinguished speaker, Dr. Arun Anand, whose insights continue to guide us and inspire us the very big way. I am Dr. Vishal Sharma, a proud veterinarian and managing director of Oriheal Lifesciences. As a practicing veterinarian myself, managing 2 clinics in North Delhi, under the name Pets Planet India Pet Clinics, I truly understand the ground level challenges, hopes, and responsibilities we all carry. Buy a vet for the vets, a mission close to my heart. It gives me immense pride to share that Oriheal Life Sciences has grown into one of India's leading manufacturer of veterinary pharmaceuticals. But beyond numbers, what truly defines us is our purpose. We are a company built by a vet exclusively to serve the vets. Everything we do, be it innovation, education, or support, is centered around empowering our veterinary community. Safe, trusted, and first in India veterinary solutions. Our product portfolio includes herbal medicines, India's first 100% safe, sugar-free, and side effect-free formulations, safe even for newborn pups and kittens. Nutraceuticals, pharmaceuticals, injections, and grooming solutions, all carefully formulated for better compliance and outcomes. Breakthrough formulations, including meropenem injection, ferropenem tablets, alprazolam suspension, tramadol suspension, furosemide suspension, mirtazapine suspension, a robust range of neuro, cardiac, ophthalmic, dermatology products tailored for small animal needs. Strengthening veterinary knowledge across India. Under our initiative Buy a Vet for the Vets, we have created one of the largest platforms to continuous veterinary education. Through regular webinars, we aim to spotlight advanced yet often unexplored topics like neurology, radiology, ophthalmology, and many more, because knowledge remains our most powerful tool in saving lives. Your support is our lifeline. Friends, this journey is only possible because of your unwavering support. Every step we take forward, every educational effort, every new product is fueled by your beliefs in us. We humbly request you to support this mission in whichever way you can. Even a small order, a word of encouragement, or referring us to a fellow vet, each gesture keeps this mission alive. Ordering us is quick and effortless. Just call or text us on the number mentioned in the chat box. Our team will personally connect with you to take your order. We deliver directly to your clinic, no middleman involved. All benefits and support go directly to you. Oriheal promotes best quality products with best trade margins to the vets. Let's walk this path together to grow, to learn, and to raise the standards of veterinary care across the nation. Thank you for being with us today and being a part of this journey. Thank you so much. Today's speaker, Dr. Arun Anand, he has completed his graduation and post-graduation from Punjab Agriculture University, Ludhiana. He acquired doctoral degree from Guru Angad Dev Veterinary and Animal Sciences University, Gadwasu, Ludhiana. He joined as assistant professor in the Department of Surgery and Radiology, Punjab Agriculture University, and rose to the position of professor and head of department veterinary surgery in Gadwasu. He acquired certificate of qualification from Canadian Veterinary Medical Association. He also cleared Education Commission for Foreign Veterinary Graduates ECF VG program USA and registered as DVM with Michigan Board of Veterinary Medicine USA. His main field of works are in urogenital surgery, joint surgery, oral surgery, especially small animal endodontics, emergency surgical procedures, soft tissue surgery, small animal radiography, etc. Let's welcome Dr. Arun Anand on this platform. Dr. Saab, are you there?
Yeah. Am I audible?
Yes, sir, you are audible.
Yes, yes. Very good. I can see a number of people are waiting for my lecture. This is excellent.
More than 300 people are there, sir.
This is good. At least I'll be happy that I can share my knowledge, which with the whole of the India and a number of veterinarians. Okay, should I start the lecture, sir?
Yes, sir. Yes, please.
Good afternoon, everyone. So my lecture is on how thoracic radiography can help in differentiate between heart disease and heart failure. So why I'm taking it as a heart disease and heart failure? Because most of the time, the dogs or the cat, they come to us in our hospital which are in the stage of heart disease, and when such type of patients, they are not caught at the right time, slowly and slowly these patients, they convert to heart failure. So that's why sometimes the lack of the treatment can also lead to to up to the heart failure. So the heart failure, sometimes it is a reversible and sometimes there is irreversible as well. I'll be dealing all these things topic in my later presentation. So once the heart failure becomes irreversible, then the treatment may not be able to save the animal. Stages, early stages of heart failure is there, which I'll be discussing in future part of my lecture, that we can treat by using some medication, like the way Dr. Sharma was telling, like pymavendin is there, benazepril is there, and number of carnitine, L-carnitine, taurine, these amino acids are there. So these amino acids can help to revert and least can help like, make the life of the patients or the pets comfortable. So why radiography is important? This is also very important point of view. Although like advanced diagnostic facilities like echocardiography is there, but still because although like it's a very old diagnostic technique, although it's a very old diagnostic technique, so still the radiography is the one of the best diagnostic facility available in a very remote area. We can use the human facility for diagnosing by taking a radiograph. So if thoroughly we are able to see the X-ray properly, or if we are able to see the changes inside the X-rays, then we can easily early diagnose a number of things. So let's come to the thoracic radiography. Although like thoracic radiography will tell you only about the external delineation, outer structure of the heart only, or the lungs even, but it will not tell you anything about the internal structure, like how much is the chamber enlargement is there, or what is the status of the valves are there. But still, it can give you fairly good picture about the status of the heart and even the other changes as well. So let me start with my presentation. So aim of my presentation is that to describe the normal radiography of the heart. So one how we can see whether this particular X-ray which I am looking right now, it has a normal heart parameters or it has a abnormal heart parameters. So that I'll be discussing. Then American College of Veterinary Internal Medicine. This is an agency which classify the heart disease. So I'll be telling you that how to classify, so that this is for your record making as well. You can create, like whenever your patient comes, you can write down whether this patient falls in category A, B, C, or D. So I'll be discussing about those things. Now, how to differentiate between the radiographic signs of heart disease and heart failure? I told you that heart disease is the initial stage, and then if it is not treated, then it can lead to heart failure. So, how we can differentiate whether on the basis of radiography, that whether this particular pet is having only heart disease or it has gone towards the heart failure. So then radiographic diagnosis of chamber enlargement. Chamber means individual enlargement, individual chamber enlargement, left atrium, right atrium, left ventricle or right ventricle enlargement. So these chamber enlargement, how we can diagnose. It is a dilated cardiomyopathy and hypertrophic cardiomyopathy. This is very common disease in cats, HTM we call. So these are the I'll be showing those X-rays as well, that how to diagnose these conditions based on that. So how to differentiate between the left side and right side heart failure? This is another important, I should say, aspect of the radiography that we can easily diagnose by looking into the X-rays, that whether the left side heart failure or right side heart failure. So if you have ECG along with the radiography facility in your practice, and that is going to help you a lot of in a treatment, as well as it will help you to whether your treatment, how the treatment is working, how better the animal is responding to the treatment. So these modalities like radiography or ECG can help you to diagnose, as well as your response to the treatment can be judged by looking at these diagnostic facilities. So let's come to the next slide. The radiography of the heart can assist in the diagnosis of the specific chamber enlargement. As I told you, right side, left side, the right atrium, ventricle. So these chamber enlargement, generalized cardiomyopathy, major vessel enlargement, like aorta enlargement, or there is a caudal vena cava enlargement is there, or even pulmonary artery or pulmonary vein enlargement is there. So they can be diagnosed by looking at X-rays. Wide cardiovascular lesions are there. We can diagnose, and congenital cardiovascular lesions can also be diagnosed by using. Now, this is very important that when we take an X-ray, so how much collimation should be done? So, if you look into the X-rays, you can see that the dog is laying on the right lateral recumbency. So, what I prefer, or what I teach to the student, and even my radiographer also follow the same pattern, that I always go for right lateral and left lateral recumbency X-rays. And if the animal is comfortable, I go for ventrodorsal. If animal is not comfortable or having a dyspnea, open mouth breathing, not comfortable, then dorsoventral radiography can also be sufficient. So if you look into this X-rays, so you can see the collimation has been done. So anterior limit of the collimation is up to the thoracic inlet. So thoracic inlet should be the anterior limit, and end of the rib, last rib, 13th rib, should be the caudal limit. Dorsally, we should have thoracic vertebrae in the X-rays, and ventrally, we should able to see the sternebrae as well. So this is the exact view that this is the exact, I should say, the view where we should able to see the or diagnose properly. Another thing is that X-ray which is done in this manner, and if it is not rotated properly, it is not done obliquely, and then it should be properly diagnosed. So if you see, let me show. Here is the cranial limit, and here is the caudal limit, and dorsal limit is this one, and here is the ventral limit. Collimation has to be. So you can see, looking at the X-rays, you can easily evaluate esophagus, cardiac failure, and then lung parenchyma, mediastinum, any metastasis, pneumothorax, pleural effusions, thoracic radiograph, and diaphragm. You can say, like, I should tell you that these structures are very important whenever you look into the X-ray. Looking at the X-ray, just looking at the lungs may not be. So we have to see the position of the trachea as well simultaneously. That how the trachea is traveling. So let me come to those points step by step. So this is the VD view. The positioners are there. If you have a positioner, that's very good. So that will help you for proper view as well. And this is on your right side is the on your right side. This one is the dorsoventral view of while taking. So ventrodorsal and dorsoventral, all they are both they will help us diagnose. So there is no preference that if animal is cooperative, I'll go for VD. If animal is not cooperative or having some lesion, lung lesions or different dyspnea is there, then dorsoventral is equally diagnostic. Then let's come to the normal anatomy of the heart. This is very important. Another thing which I want to discuss at this point is, if you look into the orientation of the X-ray, I always, and internationally it has been accepted, that how to look into the thoracic radiograph. So whenever you look into a thoracic radiograph, the head should always on, or the head of the animal should always on your left hand side, and the back or the tail should be on your right hand side. So this is how you should look into the lateral view. So never try to start looking. If you study an international books on radiography or in surgery, you will see that orientation of the axis in lateral view will be in this position only. It will not be on the reverse position. So that's why I always tell to the students as well that always keep or send the X-rays in this position only. Then it can be better diagnosed. Then let's come to the normal radiography, how the normal anatomy. So if we take, I'll be dealing with the feline cat and dog in this presentation. So for the cats, so irrespective of any breed, it's a Persian breed or a Himalayan breed or a Bombay breed is there or Spinach is there. So the cardiac fillet is consistent. It looks actually will almost look like the same. So it will not vary as per the breed. But for the dogs, so normally the cardiac or the orientation of the heart, sometime it varies. Most of the time, I should say, it varies as per the size of the dog, as per the breed, how big the breed is, what is the size of the thorax. So it varies according to the breed, it varies according to the size, it according to the body type. So normally, like whenever we talk about the feline radiography of the thorax, so you can see in the first line that the feline cardiac fillet is consistent, irrespective of the breed. So whatever the breed is there, or it's a Persian or Himalayan or Bombay or a Phoenix or there is Manx cats are there. So all those cats have a similar type of the heart which be visible in X-ray, in thoracic radiograph. But in dogs, it's little different is there. It varies. The shadow of the heart is little varies as per the breed, as per the size, as per the body type. Okay. So when we talk about the normal feline X-rays, so if you see that here it is. So this is the yellow line. If you see the yellow line, this should not be more than 2.5 intercostal space wide. It means here is the one intercostal space, this is the second intercostal space, and this is the third intercostal space. You can see that from cranial waistline. So whenever I'll be talking about the cranial waistline of the heart, I will be talking about this portion, or I'll be talking about the whole of this portion. This is the cranial waistline. And this is the caudal waistline. When I'll be talk about the caudal waistline, this is the caudal waistline. From cranial waistline to caudal waistline, if you draw a line, that should not be more than 2.5 intercostal space wide. Then if you go for dorsoventral diameter, if you draw a line from carina to the apex of the heart, then the dorsoventral diameter should not be more than 2/3 of the total diameter of the thorax. Means I'm talking about this total diameter of the thorax, not more than 2/3. It's showing the X-rays in which the dorsoventral diameter is almost 90% of the total thoracic diameter. So that's why it matters a lot. So now another point which you should look into the thoracic X-rays is the trachea. How the trachea is deviating. So if you look into this one, let me come back again. If you look into this is the ventral aspect of the thoracic vertebrae. This is the ventral aspect of thoracic vertebrae. And from the ventral aspect of the thoracic vertebrae, if you see, so I'll be highlighting the trachea now. If you look into this one, this is the trachea is highlighted. You can see it diverts away from the ventral. It is making almost 15 to 20 degree angle with the ventral aspect of the thoracic. Means it deviates caudally as well as ventrally. It is not going towards the thoracic vertebrae, means it is not traveling dorsally as well as caudally and dorsally, but it will be always traveling caudally and ventrally, and it will be deviating away from the thoracic vertebrae. So it should make at least 15 degree angle. So this also you need to see this point as well when you look into the X-rays. If you see the normal feline radiography, in DV or VDV, means in DV and VDV everything remains same. But only thing is how you have to place the X-ray. This is very important. If you look into this one, always place the X-ray in such a way that right part of the thorax should be on your left hand side. Right part of the thorax should be on your left hand side, and left part, here is the left part of the thorax, should be on your right hand side. So this is how, so all my X-ray will be in this orientation, and I always prefer that X-ray should be presented in this orientation only. Then diagnosis can be ideal, and then it will more handy. So let's first of all the apex. Here, if you see, the apex is slightly. So if you recall your anatomy class, that apex of the heart is formed by the left ventricle. Apex of the heart is formed. So left ventricle. When you look into this one, here is the apex. Apex will be slightly away from the midline. Means midline is this one. I'm talking about the midline is this one. Sorry, there is another. Ignore the other lines. So midline is, you can see that apex of the heart is slightly away from them. This is the normal. This is normal. But if it is placed quite away from the midline, it means there is some enlargement is there. So I'll be telling you how to look into this point as well. It's a diagnostic point. Then broad convexity. Broad convexity in the area is in the area of right atrium. So here is the right atrium, here is the right atrium, and here is the left ventricle. So here is the left ventricle. These two, I'm talking about the cat radiography, not the dog radiography right now. These two prominences, they will be broadest and they will indicate right atrium on your left side and the left ventricle on your right side. And there is one flat surface. Here in the green circle, if you see, there is a flat surface is visible. This is the place where is the left auricle is there. Why I am stressing this point? Because there is one disease is there which is very common in cats, not so common in dogs. This is called HCM. It's called hypertrophic cardiomyopathy. So these are the 2 points which you have to look when you need to diagnose. So that X-ray I'll be telling you, then you will come to know that how important these points. Okay, so let's come to the dog. Let's come to the canine. In a normal canine variant, in a cat, in a dog, so it is 2.5 intercostal space, same. So a 2/3 dorsoventral diameter, if you see from line from the carina to the apex of the heart, this is 2/3. So then trachea, this is almost the same. Trachea should deviate away from the spine rather than traveling parallel or towards the spine. Okay, so this is how the trachea should be traveling. So now comes to important. This is very important point. If you look into the X-rays, so this is the normal. This is a normal X-ray. So I'll be telling you about what to look into. I told you initially that the radiography will tell you about the external structure. From external structure, you have to diagnose which chamber enlargement, because it doesn't tell you anything about the internal structure. It will tell you about the external structure only. So you have to diagnose where. If you know which portion has which part of the brain, then you can, sorry, not brain, sorry, heart, then you can easily diagnose where the cardiomegaly, where chamber enlargement is. Let me, I'm going to extrapolate. Now I'm going to extrapolate the anatomy of the heart over this X-ray, if you see. Now I'm going to extrapolate. If you see, let me again repeat. So you can see I'll be concentrating on some structures. Okay. So if you see, so if you look into this X-ray, this slide, you see that from X-ray, so here the structure, here is the right atrium, okay, and right ventricle. You can see the right ventricle that will be in contact with the sternum. So it will be in contact with the, so this, and aorta. Here is the aorta, and this is the main pulmonary artery. So you can see this portion of the heart, it forms the cranial waistline of the heart. Cranial waistline means if there is any enlargement in this portion, then you can easily diagnose that if there is enlargement in this portion in X-ray, means it has to be, if there is an increased, just for example, if there is an increased sternal contact, if there is an increased sternal contact of the heart, it means it has to be, it is enlargement of the right ventricle. When right ventricle will enlarge, then it will start increasing its contact with the sternum. So if there is enlargement on the cranial, on the dorsal aspect, it means right atrium and even right like aorta enlargement can be there. Another thing which I want to discuss right now, single view may lead to misdiagnosis. Always take minimum two views, but I will highly recommend if you go for 3 views, right lateral, left lateral, TV or VDV. Okay, so single, okay, can lead to misdiagnosis. And if you see on the caudal side, so here is the diaphragm. Here is the diaphragm. And if you see the part of the heart which is in contact with the diaphragm is the left ventricle. Left ventricle. And if you see, if the left ventricle size is increased, then the contact with the diaphragm will start increasing as well. Okay. And if you see here, the structure is there. Let me go to the next slide. If you see, now you can see like I have highlighted the different portions. So right ventricle is colored, main pulmonary artery is colored, and right atrium and aorta. Means what you need to look at where. So this is very important. Now you can see the caudal baseline. So on the caudal side, left ventricle, left auricle, and left atrium as well. So here, if you see next slide, here you see, so you can see this here, the trachea. So another thing which I want to highlight at this point is, if you see the trachea is coming, from here the trachea is coming, and trachea, there is a round structure, this round structure, I'm talking about this round structure. This round structure is carina, where the two bronchi, they deviate. Okay. So if you look into the structure, this is the structure, this one. If you look into this structure, this is left atrium. You can see that left atrium is just below the bifurcation of the bronchi, just below the bifurcation of the bronchi. So whenever there will be enlargement of the left atrium, here is the left atrium I'm talking about. So it will go in between. It will start entering into that deviation. It will start a deviation, and ultimately the bronchi, they will going apart from each other. So in next slides I'll be telling you. So here you should have one point, keep in mind that just below the bifurcation of the bronchi lies the structure of the heart, which is left atrium. Okay. So now this is a diagnostic. So I'll be telling you how you can use this point as a diagnostic point. So now you see here the structure. So if there is enlargement is there, if you see the enlargement of the right ventricle is there, it will start growing toward this side, and that will come in contact with the sternum. And if there is an enlargement of the main pulmonary artery as well the aorta, then the heart shadow will start growing towards this side. And if you see there is enlargement is of the left ventricle is there, then the heart will start increasing its size towards the diaphragm. And if you see this structure, yes, you see this structure, here is the structure which is very important because left atrium enlargement is very common in dogs. So left atrium enlargement is there, it will start increasing towards. Now I'll show you once. Now see, here is the trachea, and here is the two bronchi. This is how the two bronchi will look. But if so, you know that the heart is present on the left side of the thorax. So left part of the heart will be just below left bronchus, just below left bronchus. Although in a normal heart, so there will be no interference with the placement of the bronchi as well as the heart. But if there is a left side enlargement or left atrium enlargement, then ultimately the left bronchus will be lifted upward. Here you see left bronchus will be lifted upward, and this deviation of the left bronchus can easily diagnosed or can be easily, if you are able to read it properly, then you can see, yes, in this x-ray left bronchus is lifted upward. It means when left bronchus is lifted upward, it means left side or left atrium enlargement is there. So I'll be telling you about these x-rays as well later on, but these are the points which I want. This is normal. How to look into the lateral which structure you will see, and how to look whether the structure large is there or not. Let's come to the video DV view. Then I told you in the beginning that whenever you see the x-ray, you have to place the right side of the animal towards your left side. So if you look, this is an analogy. This is the analogy, clock phase analogy. So if you consider this portion, this one, cardiac shadow as a clock, then this is the 12 o'clock position. And here, this is the 3 o'clock position, and this is 6 o'clock position, and this is a 9 o'clock position. So how to look into the video DV view? So if you see, so in a video DV view, at 11 o'clock to 1 o'clock position, there will be a position of aortic arch. And from 1 o'clock to 2 o'clock position will the position of main pulmonary artery. This is a very important point. Recently, we operated a dog, although we have echocardiography facility in our institution, but just looking at the x-rays, I diagnosed PDA in a dog because there was enlargement of the main pulmonary artery. So that's why I told you these are the structures which are very important, a highly diagnostic point of view. So I'll be showing you that X-ray as well. Recently we operated and it was in a national newspaper as well. So I'll be showing those X-rays as well. So 2:30 to 3 o'clock position, there is a position of the left auricle, and then the 2 o'clock to 5 o'clock position, there is a structure of the heart is left ventricle, and this is 5 o'clock to 9 o'clock position is the right ventricle. From 9 o'clock to 11 o'clock position is the right atrium. And and very important, you have to see that whenever you look into the left atrium, so left atrium, I told you it is present between the main bronchus. So here is the position of the left atrium. Here is the position of left atrium. It is not at this place, but it is at the bifurcation of the tree. So this is how the analogy, clock phase analogy is there. So this is how you should look into the X-ray. And if there is an enlargement is there, so the enlargement can easily can be seen by if you know about the normal radiography, how to look into the radiography in VD or DV view. So now I'm extrapolating the normal anatomy. If you see the same thing which I discussed, so if you see the aorta is at this point, main pulmonary artery, and left auricle is there, left ventricle is there, and right ventricle is there, and right atrium is there. So this is how the orientation anatomically and radiographically you should able to see, and you should, if you know about the radiographic. So I always teach the radiographic anatomy to the students before telling them about the abnormalities or anomalies, because knowing the radiographic anatomy is very important rather than knowing directly going towards the diagnostic part or disease part. So same way, if you see, if there is enlargement in DV or VD view, if there is enlargement of aorta is there, so the heart will start growing towards this. Main pulmonary artery will start growing towards this side. Left ventricle will start growing towards this point, and here the left ventricle, and similarly right ventricle and right atrium. The main thing is, if you look into this one. So if you see the trachea should be looking like this in a normal animal. But if there is a left atrium enlargement, then trachea will be diverged. You can see the yellow lines. Yellow means it's called bow-leg position of the trachea. So it will be deviated outward. It will be pushed upward by side left atrium. Okay, let's come to the next slide. Probably, so if most of the it might be having about the vertebral heart score as well. So vertebral heart score is another method to diagnose whether the size of the heart is normal or it is enlarged. So vertebral heart score is that if you draw a line from carina to the apex of the heart, and second line if you draw from the dorsal aspect, this is the caudal vena cava. It is the caudal vena cava. So if you draw a line from the dorsal margin or dorsal margin of the caudal vena cava, perpendicular to the previous line, up to the cranial waistline, then and measure these two lines and see how many vertebrae. Means you can see the black line. So you have to draw the black line and see, and another is a red line. You have to draw the red line and so see how many vertebrae they fall within these two lines. I mean, you can count 1, 2, 3, 4, and 5 in the black line, and 6, 7, 8, and almost 9 vertebrae are there. So in a dog VHS, normally if the measurement falls between 8.5 to 10.5, it means it is a normal. But if it is a more than 10.5, then it is a cardiomegaly. Same way, 6.9 to 8.1 is normal for cats, and more than 8.1 is cardiomegaly. Okay, so same way you can see the apex. So you can see even in the VD view. So if you draw a line, most broad portion, if you draw a line and this diameter and total diameter from here to here, this one, total diameter of the thorax. So the cardiac impression should not be more than 2/3 of the total diameter of the thorax. So if there is a more than 66%, it means there is a cardiomegaly is there. One thing practical I must tell you, whenever there is a cardiomegaly is there, whenever there is a heart failure or heart disease is there, treatment almost is the similar, but there is some additions are there which I'll be telling you about the same. Because hypertension will be there, and if there is a heart failure, then lung edema will be there or a situs will be there. So treatment will be almost the similar. But if you are able to diagnose it as a cardiomegaly, you can start with the treatment like benazepril or pymobandine or diuretics or in essential amino acid which are required. Then you can save the life of animal as well. But this. So let's come to that was about the cardiac shadow. Now, what structure you have to look? Whenever you look, there is, in addition to the cardiac shadow, there are a number of other structures are there which you have to look while taking, while diagnosing. Like this one, you see there is one structure is there, so which will be visible on the cranial waistline. This is called cranial lobar pulmonary artery. One I'm talking about. If you see it clearly, there is one blood vessel is going. This is cranial lobar pulmonary artery. Lobar means that is the pulmonary artery which is going towards or which is bringing the blood from the cranial lung lobes, and just below to the ventral to I should say ventral to the pulmonary artery, there is a structure will be visible. This one I'm talking about. This one, this is the cranial lobar pulmonary vein, and in between these two structure will be the bronchi. So anatomically, so all the bronchus will be having pulmonary artery on its dorsal aspect and pulmonary vein on its ventral aspect. So this is how will be visible in X-rays as well. And aorta will be visible here at this point. Aorta will be visible at this point, and caudal vena cava will be visible at this point. So if you look into the VD view, in addition to the cardiac shadow, so you have to. Okay, so whenever you look into the VD view or DV view, so almost in the middle of the thorax, in the midline, you can see the trachea. Trachea will be coming, and here is the. So these are structure you need to see. So pulmonary artery similarly. So we have in the previous, if you see the previous one, so here the pulmonary artery and pulmonary vein, you have to look at the level of fourth rib. But when you go into the VD view, same pulmonary artery and pulmonary vein, here the pulmonary artery and pulmonary vein, you have to see at the level of ninth rib. Ninth rib. So enlargement of these vessels, they will also help you to diagnose as well. If there is any cardiac failure is developing, or there is a pulmonary congestion is there. So I'll be showing those X-rays as well, where there is a pulmonary artery or pulmonary vein enlargement. So here is the caudal vena cava. You have to look in this portion caudal vena cava. Another structure is here is the apex of the heart. So apex of the heart, where it is placed, this is also matters a lot. So now comes to the second part of my presentation is American College of Veterinary Internal Medicine, heart disease and heart failure scheme classification. So heart disease, in the beginning, I told you that the heart disease is the initial stage before heart failure develops. So that's why diagnosing the heart disease and giving proper treatment will help you to prolong to the life of the pet as well. So if the heart disease is not taken care properly at a proper stage, then ultimately it can lead to heart failure as well. So let's come to the stage A. So this classification is done as per stage A, B, and C and D. So stage A is apparently healthy but high risk of developing heart disease. There are some breeds are there. Those breeds they are called as I should say poster boys for heart disease. Out of these, Doberman, boxers, Rottweilers, Cocker spaniels, they are prone to heart diseases, especially the dilated cardiomyopathy. So, and there is in cats, the Persian breed is there, and there is a Manx cats are there. They are prone to the HCM, hypertrophic cardiomyopathy. They are genetically prone to these diseases. So if even the animal is healthy, such type of breeds are healthy, and they doesn't have any sign of heart disease or heart failure, Even then we place this breed in stage A, means these breeds, they are likely to develop heart disease any time in their lifetime. You have to educate to the owner accordingly that this breed is prone to the heart disease, and ultimately it's likely to. So recurrent or repeatedly you have to examine after 3 months, 4 months. You have to auscultate, or every time when it comes for the for vaccination or deworming. So you have to auscultate the heart thoroughly. That is there any murmurs are developing, or is there any cardiac muffling is there? So once it starts, you should immediately go for radiography. You should go for other blood testing, which I'll be discussing as well immediately. And you have to start with the treatment. So means you can see there are some breeds are there which are prone. So they will be automatically will be placed in stage A. Stage B is all stage B animal will have heart disease. Just for example, if the dog comes or cat comes to you, and when you auscultated, history-wise is fine, owner says it's fine, there is no exercise tolerance, there is no night cough is there, no nasal bleeding or nothing is there, or and even when you auscultated at the time of annual examination, you found that there is heart murmurs are there. Heart murmurs are developing. It means animal heart is compensating. These ones the terms are there, compensating and uncompensating. Compensating means heart is able to compensate the incoming and outgoing blood flow. Still is able to compensate. Maybe that compensation is it. When it becomes chronic, then heart size start increasing. So it means like initially murmurs are there. It means this can be animal has to be placed in stage B, but the animal is asymptomatic. Asymptomatic means animal is not showing any sign, but murmurs are there. Then it is further classified as stage B1. B1 means animal is asymptomatic, but there is a minimal remodeling. Means when you take an X-ray, heart size, heart size is not increased. There is no alteration in heart size. But if you stage B means animal is asymptomatic, doesn't show any sign, but significant remodeling. In X-rays, the remodeling is there. Remodeling means increased chamber enlargement is there. Chamber enlargement is there. So this is stage B. But stage A and stage B is heart disease. Stage C and stage D is heart failure. Means when you have not taken care, or any or owner is ignorant, owner is not taking care, then the ultimately stage A, stage B heart disease go to stage C. Means the past or recurrent sign symptom of heart failure, but but respond to the medication. Means if you are giving diuretics, ACE inhibitor you are giving, or some medications you are giving which will decrease the preload and afterload on the heart, then animal is responding. It means animal is in stage C. Then there is another is end stage heart failure, which is not refractory to any heart medication. So that is the stage D. So always like whenever the animal comes, always try to put this staging in your records as well. So that will help you in further, like if animal, just for example, if animal is a stage C and you started with the treatment and it animal responded really well, then it means your treatment is working properly. So now you see on the upper side, this is stage C. This X-ray is stage C before treatment, and this is immediately after 1 week after treatment. You can see the whiteness, the opacity of the lungs. If you look into this one, this part, if you see the cranial waistline, so there is hardly any pulmonary vasculature is visible. But here you can see lungs have started visible. Diuretics was started, ACE inhibitors or all those cardiac medication was started after 1 week. When we took again the X-rays, so animals started showing some improvement as well. And even you can see the whiteness or radiopacity on the caudal part of the lungs. They have also decreased after treatment. It means animal is responding to the treatment. So this is stage C. Or you see this one, this is stage D. Means animal having a lot of pleural effusions are there, and there is pleural effusions and pulmonary edema is there. So you can see this is a stage D, that you can make a life comfortable to some extent, but ultimately animal may or may not respond. You can start with the treatment, but animal may or may not respond to the treatment. So this is stage. So you can see stage A, B1 and B2, this is heart disease. C and D is heart failure. Now comes to my third part of my Let me take my cardiac stimulant as well. So just in lighter mood. So let's come to the chamber enlargement. Chamber enlargement means then I'll be discussing about the chamber-wise enlargement. Means atrium-wise enlargement, ventricle chamber-wise enlargement. So here you see. So at the beginning of every chamber enlargement, I'll be showing the X-rays where the chamber remodeling has been done, but still heart failure has not done. Heart failure has not done. So this is the case of dilated cardiomyopathy. If you see, there is a soft tissue here at this point. If you see the soft tissue density is visible. Here you see, this is this is the left atrium. Allied left atrium is there. So if you see this one is already highlighted. So this is a left atrium enlargement is there. And if you see here at this point, so at this point, I told you beginning, so there is one structure, this one, this is the pulmonary vein, and here is the pulmonary artery. And both pulmonary vein and pulmonary artery should be in same size. But here in this X-ray, if you see, pulmonary vein is bigger than pulmonary artery, bigger than pulmonary artery. So let me again show you. Yeah. So am I visible? Yeah.
Yes, sir.
So
Yes, sir.
yeah. If you see at this point, so you can appreciate at this point that the one vein at this point, vein is bigger than the artery. It means heart failure can develop at any stage. Pulmonary congestion has started. Pulmonary venous congestion has started. It can develop. So although it's a heart disease is there, heart failure it may not be there, but it can develop anytime. So if you see at this point, this is the soft tissue structure. This is basically the undilated left ventricle. So here this one. So again, left ventricle. I told you left ventricle. Where you have to see. So here is the trachea and the bifurcation, and here is the left atrium, which you should see. See the position in a normal X-ray. If you see, the bronchi should be like this. Should be like this. Okay, now this is called bow leg position. Bow leg position of the bronchi. This is because bow leg is because the dilated atrium has pushed both the bronchi away from each other, and this is the typical sign of dilated left atrium. So this is the next stage of left atrium. Now the left atrium dog has heart failure as well. As heart failure, left side heart failure is there. So whenever there is a left side heart failure, then pulmonary edema will be there. Pulmonary edema. So pulmonary edema, if you see at this point, so here is the trachea. So what I told you initially, whenever there is a left atrium enlargement, it will push the left bronchus dorsally. So if you see, this one is the left bronchus, which is pushed upward. Again, I'm highlighting this one, if you see, and this one, yellow one, is the right bronchus. The right bronchus. Again, let me come again, that I'm going to repeat. So here is the trachea. From here, there is one structure is going upward, left bronchus, and this is right bronchus. So if you see, so there will be dorsal displacement of the main left main stem bronchus, loss of the caudal waistline, increased size of the caudal dorsal means the size. So here, if you see, the whiteness, radio opacity of the lungs has increased as well. But you can't appreciate the cranial waistline of the heart. Cranial waistline is you can't appreciate. Why you can't? Because the heart is surrounded by the lungs, which has edema. Edema is also white in color in X-rays. Heart is also white line, so it leads to Silhouetting's effect. That Silhouetting effect doesn't. You are not able to appreciate the cranial waistline of the heart. So this Silhouetting effect means whenever you are not able to see the cranial or caudal waistline, it means pulmonary edema is developing. Pulmonary edema is developing. So here, this is the case there was a PDA was there. patent ductus arteriosus. Patent ductus arteriosus was there. So in patent ductus arteriosus, there are three enlargements are there. One is the main pulmonary artery enlargement. Then there is a left atrium enlargement, and there will be even the main pulmonary. There is there is a main pulmonary, left atrium, and left auricle enlargement. So this one, if you see the trachea, are you able to appreciate in your screen? You must be able to, you must appreciate these things. Means you can see the position of the trachea and how the bronchus is placed. And this is the soft tissue. This is clearly, there is a soft tissue. Margins are clearly visible. In a normal heart, you will not able to see left atrium. So, but if there is a enlarged is there, it means the left atrium, this is soft tissue density can be visible just in between. And this is basically the left auricle. And this one is the enlarged main pulmonary artery. These three things have enlarged. When three things are enlarged, then first differential should come in your mind that this can be the case of patent ductus arteriosus. So now that was enlargement of the left atrium. Now comes to the enlargement of the left ventricle. Left ventricle, I told you, left ventricle is just in proximity to the diaphragm. So so ultimately the caudal waistline that will be enlarged. So let me show you the X-rays. Here you see at this point you can see from carina up to the apex of the heart. So this one is almost 80%, more than 80% of the total dorsoventral diameter of the thorax. And here, if you see, there is a light, and even the contact of the caudal waistline with the diaphragm has increased. The diaphragm has increased. So left ventricle enlargement is there. I told you when there is a left ventricle enlargement or left atrium enlargement is there, then there is a left side heart failure. Left side heart failure will be shown up in X-rays as pulmonary edema. So here you see the pulmonary edema is there. Means this dog is having left ventricle enlargement as well as left side heart failure. So you can see here, so here you see the apex of the heart. Here the apex of the heart, it has been pushed away from the midline, away from the midline. When it is pushed away from the midline, it means left ventricle is enlarged, and left ventricle, I told you the apex of the heart will be is formed by the ventricle. So it will, when it's enlarged, it will be going away towards the lateral aspect of the thorax. So there will be enlargement. There will be enlargement at 2 o'clock to 5 o'clock position as well. So you can see this part of the even you can see this part of the heart is just near to the lateral thoracic cage. It means this portion of the is enlarged. So now comes to the third chamber, which is the right atrium enlargement. So when you place the X-ray properly, the right atrium will be towards um, towards your left side. So there will be so the right atrium will push the trachea upward, and it will be J-shaped trachea. There will be loss of the cranial waistline. So I suppose everyone know about the cranial waistline, and there is increased convexity of the cranial margin of the heart. So you can see here if you see, so trachea is J-shaped. So another thing you appreciate this point. So you see that trachea, instead of traveling caudally and caudally and ventrally, it should normally the trachea should travel like this. Trachea should travel like this, caudally and ventrally. But now you see the trachea is traveling caudally and dorsally, and it is almost touching the ventral aspect of thoracic vertebrae. So this is typical sign of right side enlargement of the heart. And here you see, so even J-shaped trachea is there. This is called J-shaped trachea. And there is enlargement on the cranial waistline as well. Cranial waistline enlargement is there. So, and this is typical. And it can be as well, like I told you, this is a main pulmonary artery. So main pulmonary artery as well as aorta that also lies at the cranial waistline. But VD view will give you fairly good idea about. Let me show you the VD view of this dog. This is the VD view. If you see there is an enlargement, also we call it as a bump. The enlargement at this point 9 to 11 o'clock position. So this is the position of right atrium. So same position. So had there been an enlargement at this point, then that cranial baseline enlargement would be had to have been because of aorta. Okay, but now VD view help us to differentiate between these 2 points. So now you can see that bump is there. So there is this portion of the heart is just near to the lateral aspect of the right thoracic cage. So this is enlargement, right atrium enlargement. Here you see another dog, VD view. Here you see there is one enlargement is there. This is a right atrium enlargement is there. So, and even you can see the midline, this apex of the heart is almost near to the apex. It means left side enlargement is not there. It is a right side heart enlargement. Now comes to the fourth chamber, the right ventricle enlargement. Right ventricle means, like I told you, that right ventricle is in contact with the sternum. So there will be sternal contact of the heart will increase. So increased width of, there will be increased width of the cardiac shadow as well. Even in previous x-rays, let me come again, even you can see that intercostal space, you can see at this means here is the one, this is the second, this is the third, and here is the fourth. So heart is more than 4 ICS, intercostal space wide. Is more than it means limit is 2.5. So four more than 2.5 means 4 intercostal means cardiomegaly is there. So same way if you see there will be there will be increased tunnel contact. So trachea will be right, like a right atrium enlargement, J-shaped trachea is there. So you can see here there will be trachea, so there will be sternal contact will be increased. Here the sternal contact of the heart will increase. Trachea will be pushed. Trachea is pushed upward. You can see caudally and dorsally. So here you see that increased width. There will be increased width, and even there is a the trachea will be going upward dorsally rather than ventral. So this is another dog. You can see how big the heart is. This is because of the right side enlargement, and even you can see the trachea is pushed upward, and even you can see the white arrows. Sternal contact, sternal contact of the heart has increased. It's more enlargement. There can be chamber enlargement as well. There can be enlargement of right atrium as well as the right ventricle. Yes, there can be bichamber enlargement, but you have to look into all aspects and you have to see, like, enlargement is there, but you can see that there is enlargement as well as there is a little bit pulmonary edema is there as well. But here cranial waistline is there, although like a pulmonary edema is there, but still this is the initial stage of heart failure, left side heart failure. So this is a VD view of the same dog, which was having increased sternal contact. You can see how big the heart, like almost 5 to 8 o'clock position, 5 to 8 o'clock position. So there is enlargement is there. And I told you from here to here, if you see, so this is almost 80 to 85% of the total diameter of the thoracic cavity. So this is a common sign of right ventricle enlargement. So this is another dog which is having a that heartworm, which is having a heart in heartworm. Characteristic sign will be that main pulmonary artery enlargement will be there and right ventricle enlargement will be there. These are two signs which are characteristic for the heartworm X-rays when you look into them. And even this X-ray, if you look into this X-ray, it will look like a shoes. It will look like a shoes, not like a proper look like a shoes. So it is called a boot-like X-ray. It is a typical sign of heartworm disease. So this is about the individual chamber enlargement, right side, left side, ventricle, auricle, or atrium. Now comes to the disease in which all the chamber enlargement is there. So I told you in the beginning that Doberman, they are more prone to, even boxers. They are also prone to the dilated cardiomyopathy, and even Rottweilers are there, Spaniels are there. They are dilated to cardiomyopathy. So it involves radiography enlargement of left side and right side chamber of the heart. These are the practical points which I'll be discussing, although I'll be showing the X-rays as well. So typically left side enlargement is more predominant in dilated cardiomyopathy. Left, right, or biventricular heart failure will be there. It can be only left side heart failure as a sign, or it can be right side heart failure can be a sign, or it can be congestive heart failure as well. So anti-pro-BNP, this is very important, which I want to discuss. These are the tests which are available nowadays. So even veterinary vet diagnostic facility is quite available in almost countries and most of the part of the country. So anti-pro-BNP is the marker, which is a reliable marker for heart disease in dogs and cats. So taurine deficiency can lead to DCM in Cocker Spaniel. Other dogs can synthesize endogenously. They can synthesize within their body, but Cocker Spaniel, they lack this facility. So that's why taurine deficiency can lead to DCM, and carnitine deficiency can lead to DCM in box. So that's why addition of as a part of the treatment. So DCM whenever, so these amino acids will also help to repair the damage as well, repair the damage to the myocardium as well. Now, the normal asymptomatic. Now, this is very important. If you get a Doberman, which is normal, asymptomatic, but is having a little bit history of exercise intolerance, animal is more lazy, lying down more than the normal. And then if you have an ECG facility, and if you perform the ECG facility, if you perform an ECG, and you found there is a ventricular premature complexes are there, VPC, ventricular premature complexes are there, it means DCM is developing. Although in X-ray it might not be visible, or it might be visible initial stage, DCM can be there. But VPC, ventricular premature complexes, they will start appearing in a normal asymptomatic dog, Doberman. Yeah, in DCM, BUN creatinine can also be elevated. And DCM in Doberman can lead to, means DCM can lead to ventricular arrhythmia. This is very important. So in my practice, I have seen sometimes the Doberman, the owner calls me that my dog immediately collapsed. So so when we investigated, the animal was was having a history of DCM and was not giving proper medication. So any Doberman which is having a DCM, dilated cardiomyopathy, can have a VPC, and that can be the cause of death. It means taking care of ventricular arrhythmia is a very important point in Doberman. Just in addition to the medication which we are giving for heart medication, taking care of ventricular arrhythmia is also very important. So I'll be telling you about which drugs you should use whenever the DCM, the Doberman is having ventricular arrhythmia along with DCM. So this is the drug, maxilatin and amiodarone. These are the two drugs which are very effective in ventricular arrhythmia. So you have to, in addition to the heart medication, you have to start with these two drugs. And these drugs, they are commonly used in human cardiology. So these drugs can be easily available in the market. So once the Doberman comes and is having a ventricular arrhythmia, you should start with the maxilatin or amiodarone. Any one of them can help. Very effective in ventricular arrhythmia, which is a common cause of the death. Again, I'm repeating, can be a common cause of the death if not treated properly. So this is DCM. You can see the enlargement in almost all part of the. So even you can see here the enlargement is there. So right atrium bump is there. So even you can see the right side. Even the apex of the heart. Apex of the heart. Here is the apex of the heart. So apex of the heart has shifted from left side towards the right side of the thoracic cavity. So this is so there is there is another disease which is pericardial effusions. So pericardial effusions can have similar type of X-rays, but I'll be telling you about the differentiation point. So also pericardial effusions, I'll be showing you the X-rays as well, but that's a globoid heart. But if you, this is a DCM, and if you perform the ECG in a DCM, you will find that in lead 2, here is the lead 2. So there is allied amplitude of QRS complexes. QRS complexes are quite enlarged, amplitude has increased. So this amplitude, increased amplitude, along with this X-rays, that becomes diagnostic, highly diagnostic, that this dog is having DCM, not pericardial effusions. So I'll be showing you the ECG of pericardial effusions as well later on. But you should keep in mind that how the ECG of a DCM is looking like. Okay, so here you see increased amplitude lead to increased amplitude of QRS complexes. So dilated cardiomyopathy, this is another dog with a dilated cardiomyopathy. So this is another dog with a that is a dog with a dilated cardiomyopathy, but there is no heart failure is there. Still now heart failure has not dwelt. But this is a dog with a dilated cardiomyopathy with left side heart failure. See the difference. See the X-rays at this. They see the pulmonary tissue is visible, quite visible. So grayish density of the X-ray of the lungs are visible. But here, if you see that grayish density has become a whitish density. This is because of the pulmonary edema. Now that was a DCM without heart failure. I will keep that dog in a B1 category, stage B1 category. But this dog is stage C category. The remodeling is there, and as well as there is a pulmonary edema is there. So left side heart failure is there. So here, this is a patent ductus arteriosus. So same dog which we operated. So this is here is the soft tissue. This is the left atrium. So pulmonary vein. Here is the pulmonary artery. Pulmonary vein is bigger than the pulmonary artery. Pulmonary congestion is there, and even you can see at this there is a pulmonary edema is there. So here, so you have to compare with the fourth rib. So size of the fourth rib and size of the pulmonary artery and pulmonary vein, they should be similar, same size. All three structures should have same size. You can see at this in X-ray, the pulmonary vein, this one is bigger than the diameter of the yellow lines, yellow parallel lines. So here, and even you can see liver enlargement is there. So this is another, this is a systemic sign of heart failure. Means whenever there is a heart failure is there will be a systemic congestion. So first thing is the heart will start grow in size. Heart enlargement will be there. In the liver enlargement, so this one pulmonary edema or there is a ascites. These are the systemic sign of heart failure. So here you see two structures. So upper one is the left bronchus. This one is the left bronchus, and this one is the right bronchus. So here you see this one is the trachea, and here is the this one this is that one. The first one is the main pulmonary artery, and this one is the left auricle, and here is the left atrium. There is the left atrium. So all these when are together, then we say it can be, or most highly chances are there that this dog is having patent ductus arteriosus. Another thing, if you appreciate, if you see this portion of the heart is almost touching the lateral side of the rib cage. So now comes to the that was the canine dilated cardiomyopathy in dogs. But there is now feline dilated cardiomyopathy can be there, not so common like in dogs. In cats, HCM is more common than dogs. HCM is less common in dogs, but HCM is more common in cats. Dilated cardiomyopathy is more common in dogs, but less common in feline. But still, it can be there. It can be there, generalized. So there will be right predominant. Means heart failure will be there, but predominantly it will be right side heart failure. Another important practical point which I want to tell you, whenever there is left side heart enlargement is there, the sign will be pulmonary edema or lung edema. Whenever there is a right side heart enlargement is there, then the sign will be pleural effusions, hepatomegaly, ascites. Okay, so right predominantly, although predominantly in cats, right side enlargement, right side heart failure is there. So pleural effusion and hepatomegaly will be visible, and biventricular, even biventricular heart failure can also be. So here you see enlargement. You can see that enlargement is here. You can see even the pleural effusion. These are the signs of pleural effusions. These are the signs of pleural effusions. Here you can see this cat doesn't have left side heart failure. This cat has right side heart failure, because here if you see the lungs, they're almost normal, doesn't have edema. But here if you see this one, this is this one, this is, these are the fluid lines, these are the pleural effusions. Okay, and here if you see that these are the pleural effusions. Also these pleural effusions, these are sign, it means there is right side heart failure. But normal pulmonary parenchyma in X-ray shows that right side heart failure is there, but left side heart failure till now has not developed. Now comes to the most common disease in cats, which is hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is that is a markedly decrease. What happens? That if you recall your physiology class, that it is always taught in physiology that the blood in the body should be in dynamic mode only. It should always keep on moving, keep on moving, keep on moving. It should not stop at one point. When it stops, then the thrombus will start forming. It will start clotting. So this is the characteristics of the heart. But what happens in hypertrophic cardiomyopathy? There is a markedly decrease. So there is enlargement of the ventricle is there, but it is not enlargement outward. It is enlargement inward towards inner side of the chamber. Means inner side of the ventricle will start increasing in size. Okay. So ultimately, what happens? That the volume of the ventricle will decrease. When the volume of the ventricle will decrease, it will not able to compensate or adjust the blood coming from the atrium into the ventricle, because the volume or the capacity of the ventricle has decreased. So now what happens? The blood will start pooling into the atrium, right side atrium and left side atrium as well. When it start pooling, the speed of the blood will decrease. When speed of the blood will decrease, it will velocity will start decreasing, the clot will start forming into the left atrium especially. So this is a pathophysiology, that how, why the hypertrophic cardiomyopathy cat is prone to thrombus formation, because of the decreased blood speed or velocity inside the atrium. So markedly decreased and diastolic ventricular volume due to wall hypertrophy. It is not dilated, it is hypertrophied. Hypertrophy towards inner side leads to increased size of the ventricle, left atrium, and left side heart failure will start. So when blood that will stagnate in the left atrium, that leads to thrombus formation, result in saddle thrombus. Saddle thrombus means that thrombus will be formed in left atrium, and it will start going into the systemic circulation. When it go into the systemic circulation, it will enter into aorta, and when it enter into the aorta, even at the terminal end of the aorta, when the size of the aorta will decrease, it will block the aorta, and at that point the blood supply to the hind portion of the hind leg, hind quarter of the body, it will stop, and that will lead to paralysis. So that will lead to paralysis. So sometimes the vets, they will start thinking that this is because of the nervous trauma or spinal trauma, but that may not be because of the, maybe because of the spinal trauma, but you have to rule out that this can be because of the saddle thrombus, which developed because of hypertrophic cardiomyopathy, saddle thrombus. So blood stagnates in the left atrium, leads to thrombus formation, result in saddle thrombus. So ultimately, it leads to posterior paralysis. I suppose that each and everyone knows why posterior paralysis develops, because in the terminal portion, aorta size decreases, and thrombus will stop the blood supply, will block the blood supply to the hind quarter. So hypothermia will be developed, hind quarter hypothermia will be developed, tail to purple paws, and there will be no femoral pulse. The typical sign, animal having posterior paralysis, there will be no femoral pulse. It means animal is having saddle thrombus. You should concentrate now on towards the heart. Means this animal likely to have hypertrophic cardiomyopathy. So diuretic ACE inhibitors, benazepril, diuretics, and clopidogrel. This is a drug, clopidogrel, is effective in the anti-thrombotic drug. They are effective in such cases. But it also depends upon at what stage this is presented to. If it is presented to your initial stage, immediately it has the owner presented, and starting with the clopidogrel and these diuretics and ACE inhibitor like benazepril, they can be effective. But if it is delayed, quite delayed, and once the necrotic changes have started because of the lack of the blood supply to the hindquarter, then it may not be, this treatment may not be effective. But earlier aspirin was used to give, but now aspirin has a lot of side effects. But now clopidogrel is the drug of choice in HCM, hypertrophic cardiomyopathy. So this disease, you will be surprised to know that this disease can affect from 3 months to 17 years of old age. I mean, it can affect even 3 months of cat as well, and 17-year of old cats as well. Now comes to the X-ray. This was some about the practical point. Now comes to the X-ray, how the X-ray in X-ray, the feline HCM will. So it will be a Valentine shape heart. Why? Because there will be left atrium and right atrium enlargement. There will be no enlargement of the ventricle. I told you, it is a hypertrophy, not dilated. So no enlargement of the ventricle, but there will be enlargement of the left atrium as well as ventricle. So it will be sort of a Valentine shape heart. So ventricle enlargement may or may not be, but most of the time. So heart failure, left side congestive heart failure will be there. Left side congestive heart failure means there will be predominantly pulmonary edema, lung edema will be there. But right side heart, later on, it can lead to right side heart failure, means pleural effusions will start appearing as well. So here you see, so if you see, so at this point, the prominence, at this point, left side, there I told you, left side, you can see more predominantly, left side enlargement is there. So this is a typical sign of HCM. HCM. So this is a Valentine shape. We call it VD view. In VD or DD view, this is more diagnostic. More diagnostic is there. So you can see here the whiteness, radio opacity has increased. So this is a typical HCM in a particular cat. So if the such type of cats they come, so they will come as a exercise intolerance is not so common in cats like in dogs. The first sign in dog, sign of heart disease is exercise intolerance. But in cats, exercise, normally the cats, they don't exercise. They remain, they jump from one place to another. They remain at one place. So they don't exercise. So that's why exercise intolerance may not be a sign of heart disease. Okay? So dyspnea, open mouth breathing can be the sign of heart disease. So I'll be telling you those things later on slides. How to judge that heart failure is developing in cat. So this is a typical sign of this is HCM, not DCM. So here you see the more predominantly left side. Left side is this one. On my right side, this is left side. So that was HCM. Now comes to the pericardial effusions. There is another X-ray. I told you there is another X-ray which you can confuse with the pericardial effusions. DCM and pericardial effusions, they X-ray wise, they might look like the same. Okay, but although like there is a chamber enlargement, there's some enlargement at particular bumps are there, but still it can look like the same. Spherically, globoid heart is there. Globoid heart is there. Lack of discrete chambers like DCM. You can see here is the left atrium, here is the right atrium, here is the right ventricle and left ventricle. So there is chamber enlargement definition may not be there in pericardial effusion. Right side heart failure is more predominant because right side right ventricle has a thinner wall. So whenever the fluid accumulates in the pericardial sac, it put a pressure on the ventricle because the right side has a thinner wall. So more pressure will be exerted on the right side. So ultimately, right side heart failure will develop. So additionally, ultrasonography can be done if the facility is available. So otherwise, I'll be telling you even without ultrasonography, you can diagnose. This is globoid. Although like from X-ray, it looks like a dilated cardiomyopathy. But had it been a dilated cardiomyopathy, there would have been enlargement like this at this point, and even at this point, this enlargement. But this looks like a globe which is in everybody's home. It looks like a round globoid heart. So this is a round globoid heart. Lateral view, you can see, even you can see the how the trachea is developing. It is going upward. Okay, so this is a round. So even you can see that intercostal space is almost 4 intercostal spaces there wide, and this is a typical pericardial. This is a pericardial effusions. So now look the diagnostic differentiation. So I told you in DCM, there was increased amplitude of QRS complexes in lead 2. I'm talking about this lead 2. There is lead 2. There was increased amplitude because of the dilation. The QRS amplitude is going to increase. But here, it will not be increased. It will be low voltage complexes. These are called low voltage. These are called low voltage complexes. You can see that amplitude of QRS complexes are low voltage, not like DCM. Here you see. So these are the low voltage. So here is the diagnostic differentiation between DCM and pericardial effusion. ECG and radiography can give you clear picture whether this case is DCM or this case is dilated cardiomyopathy. So here you see. So this is the same dog after pericardiocentesis. This is the same dog. You can see the after pericardiocentesis when we took out the fluid from the pericardium. Now the chamber is almost back to normal. Here you look here the trachea. Here you see. Now you can appreciate trachea as well as the bronchus as well. Okay, this is a lateral view of the same dog after pericardiocentesis. Post pericardiocentesis, you can see now the size of the cardiac shadow. It has came back to the normal. Came back to normal pericardium. So 3-time pericardiocentesis can be tried, but if it reoccurs, then pericardiectomy is the best choice. That is a surgical aspect. So pericardiectomy has to be performed if 3 times pericardiocentesis is done and it has again came back. So this is the choice. Now comes to my last part of my presentation about the heart failure. That was all those chamber enlargement and everything. Now how to distinguish what are the radiographic sign of heart. Although like most of the part I have already discussed, but still I'm going to repeat so that you may not, to refresh your knowledge so that you may not miss any point. So left side heart failure, I told you left side heart failure means there is inability of the heart to adequately handle volume of the blood returning from the pulmonary circulation. Now look at this point that a heart is not able to handle the volume of the blood returning from the pulmonary circulation. It means that there is a stagnation. There will be a stagnation of the blood in the in the pulmonary tissue. Pulmonary tissue because heart is not able to pull blood. So ultimately there will be congestion. So extravasation of the fluid from the capillaries inside the pulmonary parenchyma will lead to edema of the lungs. Okay, I hope everyone able to understand. So ultimately it leads to pulmonary venous congestion. So there will be pulmonary edema will be there or lung edema will be there, and their lobar vein. I'm talking about the vein, lobar, cranial lobar, which you have to see at the level of 4th rib. So vein will be bigger than the arteries. So pulmonary edema will be there. Pulmonary edema will be more common the caudodorsal as well as the perihilar. Perihilar means around the carina and caudodorsal part of the lungs. So it will be non-interstitial. So this interstitium and alveolar pattern, how diagnostic, I'll be taking in next webinar as well. But you should keep in mind that left side heart failure, there will be non-structured interstitial as well as alveolar pattern. What are these? I'll be telling you about these things in detail about in the next webinar. So tachypnea, I told you. So exercise intolerance is not a common sign, is not a sign of heart failure in cats, but is a common sign in dogs. And even soft night coughing at the time of rest is a common sign in dogs, heart failure. But in cats, this sign is also absent. But tachypnea, increased breathing, especially the sleeping respiration rate or resting respiration rate, that will be more than 40 per minute. So this is the first sign of left side heart failure in cats. So whenever you look into the lungs for heart failure, you have to look in, this is the perihilar region, where first the edema will start developing in this portion. Then this is the mid-zone region, and this is the peripheral region. Means this that triangle which you are looking into, this one and the yellow semicircle, these are the 2 points where the edema mostly develops. This is this structure. This one is the perihilar, and this one is the caudodorsal part of the lungs, where the edema is most. First sign of the edema will be visible at these points. So now comes the left side heart failure. So left side heart failure, this is a perihilar edema. So whenever the perihilar edema will be there, in a normal, if you recall my initial slides, then I told you that here the aorta will come, aorta will be like this. It will be start going like this. Aorta will be visible. But whenever the edema is there, then aorta will not be visible, because it will be surrounded by the lungs, which are edematous. And so there is radiographically, there is a minimal contrast is there. So that's why the passage of the aorta will not be appreciable in left side heart failure because of the lung edema. Here you see the exercise intolerance is not noted in cats as they don't exercise. Consistent. Second point is, this is very important. Consistent hypothermia, common in cats with left side heart. Consistent hypothermia. And another thing is that dyspnea. This is a second, increase the heart respiration rate. This is a second sign which is common in left side heart failure. So the practical points, let me tell you practical. Exercise intolerance not noted in cats, consistent hypothermia, sleeping respiration rate. This is another point which I want to discuss with my fellow vets, that start looking into the sleeping respiration rate, SRR. Means when animal is resting, or sleeping. Okay, when animal is resting or sleeping, what you can do is tell to the owner, make a video, at least 2 to 3 minute video of the movement of the chest and abdomen, and then bring it to you, and you count from this video what is the sleeping respiration rate. If the normal sleeping respiration rate in dog should be less than 30, and in cats is less than 40. But if you rule out other causes like hyperthermia or any other systemic disease, because if there is hyperthermia, even then the sleeping respiration rate can be high. But if you rule out those things, and even in spite of normal temperature, in spite of there is no there is systemic illness is there, even then the normal SRR, sleeping respiration rate, is high, then it highly indicates that it can be because of left side heart failure. Now let me tell you about the left side heart, where to look for that. So now I will be highlighting this point of X-ray. I'll be highlighting this one. I'll be highlighting, you see this one, this is a pulmonary vein. Here is the pulmonary artery. Here is the fourth rib. You have to measure the size of all these three. You can see here and here. If you compare these three, out of these three, pulmonary vein is bigger than pulmonary artery, and even rib. It means there is a pulmonary congestion is there. Edema is because of left side heart failure. Now comes to the right side heart failure. Right side means when heart is not adequately able to handle the volume of the blood returning from the systemic congestion, systemic circulation, means from the organs, from the systemic organs, heart is not able to, because all those means blood will be pooling into the right side, is not able to handle. So there will be congestion of the blood in the systemic. Ultimately, it leads to organomegaly, means hepatomegaly. It will lead to hepatomegaly because of the congestion of the blood in the liver, and ultimately it can lead to ascites because of the extravasation of the blood from the systemic capillaries, and it will go into the third space, means it will go into the peritoneal cavity, and it will lead to the formation of ascites. Means visceral congestion, hepatomegaly, systemic congestion, and there can be enlarged vena cava, because vena cava that brings the systemic blood from towards the heart as well. So third place, blood transfusion, ascites, as well as pleural effusions. So here you see the pleural effusions. Pleural effusions, you see all these lungs. These are the lung lobes. These are the lung lobes which are floating in the pleural fluid. These are all means these are the fluid. These ones. These are all floating in the fluid which is present in the pleural space. This is a pleural effusion. These are pleural effusions. So these are the normal means normally the lungs looks like this normal. If you see these are the lobes. These are the normal lobes. Although I'll be discussing in detail in next webinar, but this is how the normal lobe should be there. This cranial lobe, and here is the right middle lobe, accessory lobe, right caudal lobes are there. But these lobes, all these lobes will be floating in the pleural effusions. So it will be lifted. There will be retraction. This is called a retraction. You can see this is called retraction of lung lobes from its normal position. Retraction of the lung lobes. 3D view, you can see here. Here you see. So here you see these are all lung lobes. These are the lung lobes, and outside the lung lobes here, this is all pleural effusions. These are all pleural effusions as well. These are all pleural effusions, and this is the pleural effusion fluid which is entered into the interlobar spaces. The interlobar spaces. These are the I'm talking about these when the fluid enters into these interlobar spaces. So it will be shown up in the X-rays as well. These are the lobes. These are the lobes I'm talking, different lobes. So these are the you can see at this point. Here is the lung lobe. Normally, the lung lobe should not be clearly visible like this. Why it is visible? Because these lung lobes are surrounded by the fluid outside, and there is a very good contrast between the fluid outside and the air inside the lungs. So that's why the lung lobe is clearly visible. And here I can see even the fluid line. Here the fluid line is visible. Here the fluid line is visible. And this is a right side heart failure dog, which is having a right side heart failure. Now here you see. Here you see the right side heart failure.
Just show the previous slide, no, sir, once. Where you have mentioned all the lobes. No, before this one, sir. Thank you, sir.
This one lobes,
No,
like
I'm
just
to take
this one. Which one?
Done,
This
sir.
one?
Done, sir. The lobes one. No, the next
This
one
one?
only.
Yeah.
Done.
Is it okay? Done.
Thank you,
Okay.
sir. Yes.
Yeah. So here you see. Yeah. So now comes to the ascites. Ascites can be the sign of a number of things, and one of the cause can be right side heart failure. It can be peritonitis, infection, or any cardiomegaly like liver failure, hypoproteinemia. A number of things can lead. But how to distinguish? There is a very simple test which I'll be telling you right now. That how to distinguish whether the right side ascites in this particular animal is because of the right side heart failure or because of the non-cardiogenic in origin. So this is called hepatojugular reflex. Hepatojugular reflex. So what you have to do is, when it is a positive, then it will be right side heart failure. But when it is a negative, it means it's a non-cardiogenic in origin, extra cardiac causes of ascites. How we can perform? Procedure is one person. Either this can be done in a sternal recumbency, or it can be done in lateral recumbency. It doesn't matter. Sternal, I will prefer that if you perform in a sternal recumbency, how we can do? One person examine the presence. You have to shave the cranial part of the neck thoroughly. You have to shave it, and then you have to examine the jugular pulse. One thing is jugular pulse, like in large animal, like in cows, are not so common in dogs with heart failure. If there is a congestive heart failure or heart failure, jugular pulse is there in cows, but in dogs and cats, jugular pulse is absent. So we can create artificially the jugular pulse. So how we can create? This is called hepatojugular. So how we can create is that 1% which will be standing. So it will put the pressure on the abdomen, which is having ascites, for 2 to 3 minutes. Firm pressure, and look into whether there is a jugular distension is there. Another person will be looking if jugular distension is there. If jugular distension develops in 2 to 3 minutes, it means this is because of the right side heart failure. And if it doesn't develop, it means it is because of an extra cardiac cause. Ascites is because of extra cardiac. This is called hepatojugular reflex. Very simple test. you can perform it, but we need 2 persons at a time. So you have to shave the neck thoroughly, and you have to see the jugular distension. So this is even here you see at this point, if you see this one, this is hepatomegaly. If you see, this is hepatomegaly. So this is another sign of right side heart failure as well. Now, caudal vena cava, major blood vessels. Let me talk about the caudal vena cava as well. So caudal vena cava, normally the caudal vena cava, this is approximately the same size of aorta. Okay, so it also depends upon the cardiac cycle as well. Respiration cycle depend upon the size of the caudal vena can vary, but approximately the aorta and caudal vena cava, the size is same. But it can be smaller in hypovolemia or shock, but it can be allied in congestive heart failure. It can be allied in congestive heart failure. Let me tell you, if you see, here is aorta. Here is aorta. And if you see, here is caudal vena cava. Now measure the size. So caudal vena cava is quite bigger. It's quite bigger than almost double the size of aorta. So this is particular. This is aorta, and this can be sign of cardiac tamponade. Cardiac tamponade means now the heart is not able to compensate the incoming blood from the systemic circulation. So this is typical, means we need to support the heart. We have to decrease the preload and afterload on the heart, so that heart has not to function, has not to pump the too much fluid or blood outside. So we have to support. So those are drugs are there, cardiac medication need to be started. So this is a typical sign of cardiac tamponade. So this is another sign of congestive heart failure. Look at this point, perihilar area. Here is the perihilar area. Even I can see one, this is going up, sorry, this is one, this is going upward. This is another bronchus is going downward as well. So this is because of the chamber enlargement, and there is a perihilar area, and there is an increased radio contrast. So that's why you can easily see the bronchus as well. Here, this point, that this is the perihilar area. In beginning, I like in the middle of the slide, few slides back, I told you that this is the area where the edema dwells first. So perihilar area as well as the caudodorsal part of the lungs. So here, when you start, if you are able to see the main stem bronchus, like this one, main stem bronchus, like see the arrow, black arrows, main stem bronchus, it means now the cardiac failure is developing. Cardiac failure is developing. Here too, if you see, here too, this is a typical, this is called alveolar pattern. This is a typical sign. Alveolar pattern means these are called dry leaves. You can see winter tree like appearance. Let me do it again. See. And I'm going to do. Okay, so this is alveolar pattern. When alveolar pattern is there, although I'll be discussing in the next webinar, but when alveolar pattern is there, especially at this point, then it means that there is a heart failure is developing. Here you see at this point. Can you see it looks like a branching of the tree? It looks like a branching of the tree. This one is the branching of the tree. So this is called alveolar. This is called air bronchogram in the cranial, middle, and caudal lung lobes. So this is a sign that the heart failure is developing. This is alveolar sign. How do we can easily perform few tests as well? So if there is a situs or pleural effusions are there, then a situs, or you tap it and take out the fluid and send to the lab and for protein estimation. Protein estimation as well as the cytology. If you see the cytology as well, means apply on the slide immediately, take out the drop, apply on the slide, make a slide, send to the lab, and send the fluid to the lab as well to estimate the protein inside. If the protein is less than 2.5 gram per deciliter, and the cell inside the cytology is less than 500 per microliter, then it means you have to think about the right side heart failure or hypoalbuminemia. Okay. But if the same fluid, which is having more than 2.5 gram deciliter, protein and nucleated cytology is more than 300 to 500, then you have to think about these differentials. Diaphragmatic hernia, long-standing tarsodate, lung lobe torsion can be there. I'm talking about the fluid which you take from the pleural, from the thoracic cavity after thoracic tap or mediastinal neoplasia can be there. Or if there is a protein is more than 3 gram or nucleated cells are more than 3000, neutrophils are predominant, then it means this is because of some pyogenic processes going on. Some septicemia is there. It means in cat, it can be because of Pasteurella, or this can be dog, can be because of these things, or CBC should also reflect there is neutrophilia with there is a increased TLC level as well. Means this is how you can further add up into your diagnosis as well. Means by taking out and diagnosis as well, and this will also help you in further treatment as well, treatment to follow. So now let's come to the end of my presentation, that whenever you read the thoracic X-ray, you have to see the shape and size of the cardiac cell Houghty, and then you have to see the pulmonary parenchyma and its radio opacity, and then you have to see the major blood vessels. Then you have to see the passage of trachea, which I highlighted a number of slides, how it is traveling, caudally and ventrally, or it is a parallel to the thoracic vertebrae, or it is going converging towards the thoracic vertebrae, means caudally and dorsally. This is very important. Passage of trachea will tell you a lot of things. Then cranial and caudal lobar vessels at the level of fourth rib, and at the level of fourth rib in lateral view, at the level of ninth rib in VD or dorsoventral, DV or VD view. Okay, and diaphragm has to be seen simultaneously. How much contact of the diaphragm is there with the heart? This is also, so means these points has to be looked into the X-ray for final diagnosis. Okay, so you have to evaluate all the views. Means single view can lead to misdiagnosis. At least take 2 views, but I will highly recommend go for 3 views: right lateral, left lateral, DV or VD, anyone out of these two. Thanks you very much, sir. Now I'm open for discussion. If you have any query, just let me know, sir. Why it is called hepatojugular reflex? Because ascites can be because of liver in origin or can be because of cardiac in origin. So that's why it is called hepatojugular reflex. Means if there is a left side, if there is ascites is because of a hepatic in origin, then jugular congestion will not be there. If there is a ascites is because of cardiac in origin, then jugular, I should say, jugular congestion will be there. So that's why it is called hepatojugular reflex. Internationally, it is known as hepatojugular reflex.
So can you access the chat box, sir? Now some questions are coming.
Yeah, let me see. Yeah. There is another question: is the transutate from the ascitic fluid or from the pericardial? No, not from pericardiosynthesis. It is from either from the ascitic fluid or from the pleural effusions. Then next question is, can we fix Foley's catheter in case of pericardiosynthesis? Probably I have to take another webinar on this pericardiosynthesis. But no, pericardiosynthesis you can't put the Foley's catheter. Foley's catheter is only for pleural effusions, not for this one. For pericardiosynthesis, only pericardiosynthesis can be done 3 times, I told you. But if after 3 times again it refills back, then pericardiectomy has to be done. Pericardiectomy means you have to remove the pericardial membrane. So there is some appreciation is there. Very good presentation. Thank you very much, sir. Thank you. There is it's all look good. We get brachy breed. Please tell us how we can differentiate between normal and abnormal brachy. No, it is hardly you can't because I told you in lateral view you have to take the view from the thoracic inlet, because if you take a view from the skull, then you can differentiate. But as for X-ray, you collimation has to be done in such a way that the cranial aspect should be thoracic inlet, caudal aspect should be the last rib, so that it can't be done. So, sir, can you tell me what level should we take a diameter of the? So I told you have to compare with the fourth rib. Fourth rib is the diameter you have to. Means ideally there is no parameters are there because of the size of the pulmonary vessels and the rib that vary according to the size of the dog. Bigger dog will have a bigger rib, so you have to compare with the rib. So there will be no parameters are available. Take webinar on biomarkers as. Okay, I'll take my suggestion. I'll do it. Please explain size of the cardiac tamponade regarding size of the caudal vena cava. Caudal vena cava means cardiac tamponade. Only thing is you have to compare with the aorta. Size of the aorta and the caudal vena cava should be similar. And if it increases, then it means cardiac tamponade is well. During expiration, diaphragm is closed, and that's why I always tell them that take two views at least, right lateral and left lateral views. Questions are going very fast. Sir, can we differentiate between cardiac tamponade and pericardial effusions? No, these are two different things. There is hardly any confusion. There are two different things. Can we have lung X-ray webinar? Yes, I will. I will talk with Dr. Sharma. So we will take about the lung X-ray webinar as well.
I think
so next time,
the next is going to be the lungs.
Yeah, next is going to be that what lungs will speak in X-rays. Yeah. So suggest proper line of treatment of DCM. So DCM proper line of treatment, I already show you that you have to check the ECG simultaneously. That if there is a VPC is there or ventricular arrhythmia, you have to start with the amidron and maxilatin. Otherwise, all other cardiac is pymobendin, benazepril, and diuretics. And there is amino acids are there, L-carnitine, taurine. These are the line of treatment. And when pymobendin is contraindication. No, pymobendin is not a contraindication in HCM. No, it is not. It can be given as ACE inhibitors as well, but it should be given cautiously. It should be given cautiously. Or if you want to give, you can give in a combination with the benazepril. Or you initially you can start with the benazepril, and if animal respond, that's fine. And if still there is some signs are there, animal still is showing towards the left side heart failure, then you can combine with the pymobendin and benazepril as well. Okay, please talk about the orthopedic safety. I'll think about it. So is it advisable to prescribe ACE inhibitor without measuring BP? I should say BP is another point, but if there is a X-ray shows there is a heart failure is there, and there is a tachycardia is there, it means BP likely will be higher. So ACE inhibitor has to be started, and you have to see the response as well. And if you have BP, like if you have a Doppler as well to measure the blood pressure, that will be additional benefit, I should say.
Sir, I have studied when I was studying pimobendin. So there was a study that pimobendin efficacy increases when it is given with a small amount of ACE inhibitors.
ACE
So
inhibitor,
that's why they have the synergistic effect.
Yes, yes. I always recommend that pymobendin and benazepril or ACE inhibitors. They have a synergistic effect, and the animal is quite comfortable after giving. So in Sri Lanka, we don't have people are from Sri Lanka as well. That's very good. In Sri Lanka, we don't have such resourceful person like you. Excellent. Okay, thank you very much. This is a compliment. I take it as a compliment. Excellent and informative presentation. I went to Sri Lanka as well. One thing I must tell you. Last December in Kandy, there is a veterinary college in Kandy. So I gave my presentation in Kandy as well. Probably if they will call me again, I'll definitely will be happy to go. It's a beautiful country.
Sir, in today's webinar, just for information, there are 4 registrations from Sri Lanka, 8 registration, then 4 registration for United Arab Emirates, then we have Fiji, then we have UAE, and then we have Malaysia, 2 responses, and then Romania, we have 1 response. From Nepal, one student is here. So we have from Canada, we have 1 response. So there were many fans.
It's an international seminar.
Yes.
Yeah. So there is another question: is there difference between pulmonary venous congestion and pulmonary hypertension? Pulmonary venous means depending upon radiographically, you will not able to differentiate. Only pulmonary congestion will be visible. That too, when there is enlargement of pulmonary vein as compared to 4th rib size in lateral view. Pulmonary congestion can be. Pulmonary hypertension can't be, because this is not a dynamic method of diagnosis. This is a static method. Means you take an X-ray, look into. It's not a dynamic.
So there
One
is
of the best.
one registration from the Germany also. Doctor has mentioned that.
Oh,
But
so nice, so nice,
so
so
this
nice.
is really good. This is our effort is it
Yeah.
is showing effects. Yeah.
And sir, how many people were there in webinar?
Sir, there were the peak time there were 340 plus veterinarian. 346 was the highest strength when people were there.
Okay,
So
okay, okay, okay.
so
Somebody,
almost
someone.
they got
Yeah,
benefited.
yeah, yeah. So I'm happy that I'm able to share my knowledge with so many people, and that too even global. I should say global presentation.
Sir, when I heard you and your this topic personally, I knew that this is something like a practicing veterinarian needed badly in its practice because most of the places there is no facility of ECG or echocardiography. So X-ray is the
Yeah,
modality where they can depend. X-ray is the something that can be taken from anywhere, I mean, from human lab also. So if a vet can diagnose case on the basis of X-ray only, that is the biggest thing he can be done.
yeah. One thing more I want to add on. This is the oldest diagnostic and still valid.
Yes, yes, sir.
Still
Yes, sir.
valid.
Yes, sir.
And if you are able to look into the X-ray, and then you can easily diagnose a number of things. And you may not need advanced diagnostic facility for even few, I should say, and especially for the heart and the thorax. Thorax X-rays are highly diagnostic. In thorax, ultrasonography is not as diagnostic as X. So that's why I always my students that try to use the X-ray judiciously and try to read it. X-ray will tell you a lot of things. So there is another question: is hepatic congestion the cardiac on a region? Yeah, it can be. I told you that whenever there is a right side heart failure is there, heart hepatic congestion can be there. And if there is a heart enlargement, this liver enlargement is there, it doesn't mean that it is exclusively because of cardiac region. It can be because of other region. So that's why you have to see a number of things. You have to see a number of things. You have to look into the X-ray of thorax. You have to look into the abdomen as well. Hepatomegaly can be of other reason. One of the reason can be because of the right side heart failure. Sir, one webinar on echocardiography. Okay, sir, we will think about it. When we are not supposed to give furosemide in heart disease. Furosemide, I should say diuretics. Initial treatment is diuretic, and there is a lot of extra fluid is there inside the body. You have to push, you have to take out the extra fluid. Then first line of treatment has to be provided the animal is not dehydrated, and you have to check the kidney status as well simultaneously. So first line of treatment is furosemide, inhibitors, as well as pymoband. People VHS measure about will always measure about 11 T, 11 vertebrae. When we can suggest cardiology, whenever it is more than 10.5, whenever VHS is more than 10.5, then it is it advisable to present ACE inhibitor without measuring? Again, repeat question. Uh, One thing is, whenever there is X-ray, you have to see a number of things. TP is one of the aspects, but you have to see the history, you have to see the signs, you have to see the radiography, and if blood pressure facility is not available, and if there is a cardiac enlargement is there, or if there is a pulmonary edema is there, then ACE inhibitor has to be given. ACE inhibitor has to be given along with the diuretic. So BP you can measure later on as well, but first line of treatment has to be started. Otherwise, you can lose that animal. So you have to decrease the pressure on the heart. You have to decrease the preload and afterload of the heart, and that can be decreased only by giving diuretics, ACE inhibitor, and pymobandine. You have to. You will see that once you start with the treatment with diuretic, in next 3 days, you will see the animal is comfortable. And I told you
Yes,
about SRR as well, sleeping respiration rate. That will improvement in the sleeping respiration rate after therapy can also tell you that you are in the correct line of treatment. Can diltiazem be one of the drug of choice in film? No, I will not recommend this one because diltiazem is channel broker probably. Yeah. So this will not be, so I will suggest that go for ACE inhibitors, go for pymobendin, go for clopidogrel. Okay, and if there is a edema is there, then go for diuretics. So this will be when pymobendin is contraindicated. It's not contraindicated in HCM, but in combination with ACE inhibitors, can be tried as well. I think probably we have already done with these questions.
Yes, sir. So, sir, on behalf of all the veterinarians who attended the session and the entire team of Oriheal Life Sciences, we sincerely thank you for taking the time to share your knowledge in webinar on how thoracic radiography can help to differentiate between heart diseases and heart failure. This session was extremely informative and practical, and it helped simplify many key aspects of small animal radiology for our attending vets. The way you explained the techniques was not only clear but also very relevant for daily clinical practice. We truly appreciate your support in contributing to veterinary education, and thank you for being a part of our initiative powered by Oriheal Cardiac Medicines. Looking forward to many more such meaningful sessions. Thank you so much, sir.
So nice. So I really appreciate your stage as well, your platform, so that I can share. So our motive is that our patient, which are voiceless, can tell you, but we have to treat them, we have to make them comfortable. So our motive should be that we should make our patient comfortable. So this is one of my effort towards that.
Thank you so much. Thank you so much. And for everyone's information, Oriheal Life Sciences manufacture Pimobendin Plus, that is with benazepril, exclusively separate benazepril. Then we make L-carnitine and taurine supplements with berberine and hawthorn, which is the most advanced formula in India. Then we make furosemide in suspension form, especially for cats, so that the dosing and administration is simplified. And we have torsemide also available. So do support us and do support our cardiac range. Thank you so much, sir.
Okay, sir. I'll leave. Thank you very much for Oriheal for giving me the chance to share and interact with the veterinarian. Thank you, sir.
Sir, we are waiting for the next webinar. Sir. Thank you so much. Okay, sir.
Most trusted pharmaceutical company for companion animals of the year goes to Oriheal Lifesciences Pvt Limited, Dr. Vishal Sharma from Oriheal Lifesciences Pvt Limited.